Hello, and welcome to another episode of Triage Trauma and Drama. My name is Matt. I'm your host, and let's dive right in. Last week we had a very amusing story about me and a cat and kicking a cat down the stairs and the resulting anaphylaxis, which, to be fair, that's happened like 4 times in my life on the job. 2 of them most recently. Anyway, this episode I'm gonna tell you a story about me taking care of a patient who was a PDF file and the moral quandary they kind of put me in as a human being because, well, yeah, you'll see later on in the story, and then maybe talk a little bit about some of those situations we find ourselves in as medical professionals dealing with PDF files, just people that are not great human beings. We have to kind of turn off that moral part of our brain and switch it over to I'm a caregiver. Regardless of what this person's done, it is my job to take care of them. On this particular night, I was working for an interfacility transfer company. So again, we go to places, pick people up, take them to bigger cities, whatnot. This particular night, it happened to be very, very foggy out, like a pea fucking soup, right? You couldn't see more than 100 yards down the road. And so much of the fact that we'd actually turned down a couple of out-of-town calls because it's foggy. The patients weren't that sick. They could wait a couple hours until morning when the fog would burn off and we could safely get to them. This particular facility called us for pretty much everything, and they called us to transport I don't remember the guy's name, name. I'm not going to tell you any of those. Obviously, I'm not going to tell you his name. I don't remember the age. Mid-60s, we'll say. A mid-60s male to one of the bigger, more comprehensive medical centers in the city, because for a polypharmaceutical overdose. So what a polypharmaceutical overdose means is that you took a shit ton of drugs trying to kill yourself. Maybe they were lucky and they found all of the bags and the prescriptions at your house or where you live, or we're just going to assume that you took a bunch of shit. In this particular instance, once we got there, we'd find out that he just took a bunch of different shit. Like there was a baggie full of medications, but no one was really sure what those level of meds were beforehand, what was in those meds beforehand, any of that. Like no one was really sure about any of those things. Anyway, so we get this call, and we start taking off to go to this facility, and it takes us about 40 minutes to get there. It usually takes about 20 to 30 minutes. Again, the fog was really bad. It was just you couldn't see anything. Like, enough to make me genuinely scared about trying to get this person to this other facility because it was just going to take a lot of time because you couldn't see anything. And these are not highways. They're 2-lane highways. They're back roads. They're not, sometimes there's not a town for, several miles. There's not, a house for several miles. So, not great situations, especially when the weather gets to be like that, where you really can't see what you're doing. We pull up to this facility. In the onset, we notice there's a large presence of law enforcement agents. Like a lot of law enforcement is there, which is weird, especially for like 3:00 in the morning. We get inside, we get the guy moved over to our gurney, over to our ventilator, over to our drips, and he is, I would say, in critical condition. They wanted to fly him via rotor wing or helicopter, but they couldn't because of the fog. So he's in fairly critical condition. Critical condition enough for me to be like, oh, I don't really want to be alone in the back of my ambulance with him. Because he's got like 5 different drips going, and he's, and they're like, well, he hasn't coded yet, but he keeps getting just to the edge and then stopping. And I'm like, great, this fucker is going to code in the back of my ambulance. Not that that's foreshadowing or anything. So I get him loaded up, and I was paying attention to the nurse report, and my partner was kind of listening to everything that's going on in the background. And so we get out to the ambulance, and we're getting him in the ambulance. We're getting him, get all of our equipment plugged in, get him switched over to all of our stuff. And he stops and he goes, hey, that they were actually on their way to arrest this guy for being a PDF file when they found him down and unresponsive. And I was like, what? He's like, yeah, apparently he was they did this big sting, and they think he's a big PDF file. Like they were on their way to arrest him when that happened. And now I look down at the guy and I'm thinking, well, fuck me. I got to keep you alive for 45 minutes till we get to this other facility. Now, granted, I don't know. I mean, turned out in the end he was. But at that moment, I didn't know for sure. I was just going about what law enforcement had said and what my partner had said. So I was like, well, shit. I got to keep you alive. All right, well, you know what? It's not my job to play judge, jury, and executioner. And I remember saying this to a young paramedic several years down the road, saying that's not really our job. Our job is to take care of patients. Like, my job is to take care of you whether you are a PDF file, whether you are a grapist, whether you are a white nationalist, whether you are an atheist, whether you are a black person, a brown person, a yellow person, a blue person, a green person. It doesn't matter. My job as a healthcare professional is to take care of you. If you were in my ambulance, if you're in my room in the emergency room, you are safe. My job is to take care of you, no matter, regardless of your personal preferences. I'm not condemning their actions. I'm not condemning the way they think, but I'm condemning the way they think, condemning their actions. I'm not condoning the way they think of their actions. But that's not my job at that moment is not to pass blame. It's not to pass judgment. My job is to take care of the person as an individual who is in my ambulance, is in my ER. They're my patients. So we're like, well, fuck, we can do this. We're professionals, contrary to what people think about me sometimes. So we get going down the road, and already, like, if this were any other normal night, hopefully he'd be flying, but we would be traveling lights, sirens, code 3, trying to get there as fast as we can. Well, the problem is that we can't, again, this is the fucking fog everywhere. So we know we can't drive very fast and recklessly, because that's not going to do anyone any good if we all get ourselves killed getting there. So my partner, thankfully, decides to drive he was going as fast as he appropriately could for the road conditions. But that left me in the back with this very unstable guy. And, like, his blood pressure was doing some weird shit. His heart rhythm was doing some weird shit. To the point of where we were just getting ready to kind of leave that little area and hit the main interstate, and we get stopped by a fucking train. I shit you not, a train. And my partner is cackling, laughing from up front, and I'm just saying every swear word in the book in the back because I'm like, Jesus Christ, we're stopped by a fucking train. You gotta be kidding me. A train? Like, what's stopped by a train? It's 3:30 in the fucking morning. Why is there a train? So, as we're sitting there at the train tracks, I'm watching, my patient, the monitor, and the ventilator, and all the other things I'm watching in the back. I notice his blood pressure starts to drop. I'm like, well, that's unfortunate. So I do some adjustment with some of his fluid. It drops again. I'm like, well, I looked right at the patient, and he is out of it. Not even sedated. He's just out of it. And I was like, well, you better stop. And then it drops again. So now I'm like, well, this is going to be a problem. So I have to go over and up some of the pressors he's on, because his blood pressure at this point is like, well, it's getting crappy. It's getting low. Like, I don't want it to continue to drop because it's not good things are going to happen. So finally the train clears and we go on through and we start heading again down the highway, and we're probably about, 5-10 minutes from the interstate. His blood pressure has since stabilized, thank God. But now he's having these weird arrhythmia runs on the monitor. Like, not really PVCs, not really PACs, like just weird runs on the monitor of ectopic beats, I guess I'll call them. Like, I'm not even sure what the fuck they were. So I was like, okay, well, that's weird. So, like, at this time, you pushed a button that printed out your rhythm strip, because that's how long ago this happened. And so I pushed the button, print out the rhythm strip. I started a pile. I started saving them because I'm like, well, I don't know what this is, but the cardiologist probably wants to know about it, and the doctor at the other facility probably wants to know about it. So I'm starting a pile here. And we're just going to get on the interstate, and all of a sudden we start slowing down again, and I'm thinking, okay, well, what is it now? Now, ahead of us, on the road, I shit you not, are cows. Like, a bunch of cows. Like, just like someone's cows got out. And at that point, my wonderful patient decides to go entirely into VFib. So VFib is short for ventricular fibrillation. It's where the ventricle, so the bottom part of your heart, the big thick muscle at the bottom, just kind of quivers. It doesn't actually pump blood anywhere, which is bad. Your organs want blood. They want oxygen that's in your blood, so that's bad. So he goes completely into VFib. Now, he's already hooked up to our monitor, so I say, a litany of swear words. My partner turns around and goes, what? I tell him he's in VFib. He gets out of the car, gets out of the ambulance. So now we're parked on the road in the middle of fog with our emergency lights on, cows in front of us, and who knows what behind us. He gets out, jumps in the back, starts doing compressions. We charge up the monitor, shock the guy once, back into a sinus rhythm. So, okay, great. He's not dead all the way. So we wait a couple minutes. He does not slip back into it. The cow is now magically parked the roadway. I don't even know where the fucking cows came from, but there were cows, okay? Cows part the roadway. He gets back in the driver's seat. We start driving again. We get on the interstate finally. And I know, as soon as we get the interstate, I got about like 30 minutes. 30 minutes, I'll be at the other hospital. This guy's not my problem anymore. I don't have to worry about him at all, okay? Like, I know that. 30 minutes. Going down the road, and we pass one of the bigger hospitals. At this point, the fucker decides to go and do VFib again. And so I tell my partner, and obviously he's driving down the highway / interstate. He can't get around and come back and help me. So I just charge it up, shock him again. And he goes right back into a sinus rhythm. Perfect, wonderful, great, whatever. And so we get another 5 minutes down the road, and the fucker does it again. And so I'm like, Jesus Christ. I tell my partner, again, he can't jump around and coming back. So I witnessed it, charged him, shocked him again. Back into a sinus rhythm. Now, this is the third time that's happened. So I'm thinking, okay, his heart's pretty fucking irritated. Whatever he took is causing a lot more problems than what he thought it was probably going to cause, right? So I call, head to the other facility, say, hey, we are about 20 minutes out. I've shocked this guy 3 times. Like, I can't go up on my pressors anymore. His blood pressure is kind of crap. His, he just looks kind of like crap. Like, I don't want to dump any more fluid into him in case his heart's failing. I'm going to overload his heart. It's a whole bunch of different things are going on in my brain, right? Like, I don't know what this guy took, but he's actively trying to die. And the part that I kept wrestling with is every time he would go into that rhythm, I would be thinking, I could just not hit the button. That would save a lot. That'd probably make a lot of people happy. Just not hit the button. And I don't have a problem admitting that because I am a human being, and I think we have some of those thoughts sometimes. But the instant I had that thought, I was like, nope, not my job. Like I said a little bit ago, my job is to get you there in one piece, take care of you. If you're in the back of the ambulance, taking care of you is not my job. So the asshole, right as we're getting off the on-ramp to the bottom of it, and at this point the fog is much less dense. We're in a city, we can go a little faster. We get to the bottom of the on-ramp, and there's a fucking accident. Like a 3-car accident. It's like stuff all over the place. My partner starts laughing hysterically, at which point I yell just fuck really loud, because I'm about done with this call at this point. I don't fucking care anymore. So he goes around the accident, kind of over the median and back on the other way. I'm sure the cops standing there. I mean, we had our emergency lights on. I'm sure the cops standing there like, what the fuck is going on here? But as soon as he comes over the bump, we start going down the road. I can see the hospital, right? Like I look out through the space in the ambulance. I can see the other hospital. I'm like, okay, we're almost there. The fucker does it for a 4th time. This time I shock him. Doesn't come out of it at first. So I start doing chest compressions. My partner's like, do you want me to stop? I'm like, nope, just get us there. We're 3 minutes down the road. Just get us there. That's all I care about. Just get us there. So I start doing chest compressions, and I keep doing chest compressions, do it for about 2 minutes, let go of the chest, look, still in VFib, shock him. Comes out of it with that shock. At this point, I'm over this dude, right? So as we're pulling up the back, we pull up the ramp, and this had a weird circular ramp, this particular facility did. Pull up the ramp, come to a stop. As we're getting him out of the cot, out of the ambulance, he does it again. At this point, there's a thing called a precordial thump. You're not really supposed to do this, but basically you just smack the person in the chest really hard. That's what I did. The entirety of my career, I've probably done the move, 8 different times. It's never worked. Fucking worked this time. Back into a sinus rhythm. So it's like, okay, this fucker, I'm done with him. He has get off my cot, get off my ventilator, get off my monitor. No, I'm done with him. Not doing this anymore. Get him into the other facility. We track down the room he's going to. They get him in there. Respiratory's there. They get him all settled, and the charge nurse is there. I give her report. I give the bedside nurse report. I give the respiratory therapist report. The doctor report. I'm telling the doctor, I'm like, yeah, I fucking shocked him like 4 times. Then he comes out of it right away, but he sleeps into the VFib, and I shock him the entire time. And there's some questions about, some drug dosages and stuff, all the stuff he was on, and finally the doc looks at me and goes, well, you know what, why he tried to kill himself? I was like, yeah, I know, apparently they say he's a PDF file. The doc's like, no, they found a lot of proof that he is actually a PDF file, and I was like, well, again, not my job. That's not my job to make judge, juror, execution. He's like, yeah, would have made a lot of people really happy, though. And then the doc walks away. And I was standing there going, like, I could understand that. Like, trust me, I can totally understand that feeling. But, and like I said, I'm not ashamed to admit that part of me didn't think that. Like, every time this fucker tried to die, I'm the one who brought him back to life. Every single time. And, thinking about that, I was like, well, I can understand people's feelings, but that's not my job. That's not our job. It's not our job to do judge, jury, and executioner. It's not our job to arrange the meeting between this person and the hereafter. Like, Our job is to take care of people, and that's incredibly hard sometimes to remember, especially if you're taking care of like a white supremacist or a homophobe or a racist or a any of those people. Like, it's really hard to remind yourself that you are the bigger human being. You have a job to do, and that's to take care of anyone who gets in your rig, anyone who walks in your ER. That's our job, and it sucks sometimes because we have to be those bigger people. But anyway, the guy actually ended up living and ended up standing trial and ended up being sent away for a very long time. So I guess the moral of the story is sometimes keep fuckers alive. Yeah. I hope you guys enjoyed this particular episode. It was a little bit longer than most, but it was a bit more to the story. I think earlier I said ventricular tachycardia or fibrillation. He was in VFib the entire time, which is where your ventricles fibrillate, sorry. It's been a long day. It's been a very long day for me. So anyway, I hope you guys enjoyed that episode. Look for another episode next week. You guys keep having a great day. Keep making good decisions. Keep yourselves safe. Keep each other safe. And, yep, we'll see you guys next week.